Hello, good evening. Hi, my name is Talalay. Great to have you guys here tonight for our discussion about the path to USMLE Success. Which is kind of a shortened version of First Day for the USMLE Step 1 in terms of what we talk about and, with regards to exam preparation. Again, my name is Tal, and I'm a professor of biology and immunology at the University of Louisville in Kentucky, but most of you folks know me better for my work with First Day for the USMLE Step 1 and the First Day for the USMLE Step 1, 2, and 3 series, as well as my role as the founder and the original editor-in-chief for USMLE-Rx and ScholarRx. Want to welcome you all. We also have some wonderful panelists that will be helping to answer your questions tonight. So I want to introduce them to you. So we'll start off with Sean Nanji. Sean, would you like to introduce yourself?
Absolutely. Thank you, Dr. Lee. My name is Sean. I've been with USMLE-Rx, specifically with RX Coach, for almost 3 years now, working individually with our coaches like Boris and many others, and students just like you to help you accomplish your academic goals. So happy to be here, and I look forward to answering your questions this evening.
And great, that's a segue into our other outstanding, RX coach, Paris.
Thank you, Dr. Lee. Hey guys, my name is Paris. I am a dermatology resident at UT Southwestern in Dallas, Texas. I'm also an RX coach with USMLE-Rx, so I work one-on-one with students such as yourselves to help prepare you guys for the USMLE Step 1, Step 2 CK, and I will be helping to help answer some of those questions.
Excellent. So as you heard, they're happy to field any questions you have. There is a Q&A panel that you can access. If you're on a PC or a Mac, it's typically on the right side of your screen. And if you pop it out, you should be able to find a place where it says questions. You can ask your questions. If you're on a mobile device like an iPhone or an Android device, it should be in one of the one of the tab bars. So feel free to ask questions, and if so, and also if appropriate, you can also get access to them for a quick consult to see if they can help you with further studies. We'll talk a little bit more about the ARCS coaching program, at the very end. All right, so let's get going in terms of talking about the USMLE Step 1. So this is the first word that we have in first aid. It's been around for 30+ years. And again, the context and the idea is that it's really about thinking about this exam as a marathon rather than a sprint, and really planning and delivering. So in order to do that, you want to relax. You want to be able to take the long view. And so in order to do that, we'll obviously provide this overview with regards to the basics, defining goals. We'll talk about some recent USMLE updates. As you know, a lot of things are changing with the exam. Timelines for studying, how to approach subjects, choosing resources, some just additional advice. Talk more about Brooks and RX Coach at the very end. And then we do have a raffle and a special offer, some discounts, so you can save a ton while getting great education. And then we'll open it up for some Q&A, so to take care of any questions you have. So we'll start off with a question here, just to get you guys warmed up and to see who's out there. So I'm going to open up a poll. So I'm going to launch a question, and I want to know who you are. So you should see a poll any moment now, and you should be able to answer, in terms of what type of question what type of student or learner you are. You may be, international graduate or medical student, or you can be a U.S. student. Sorry, about a good 20-30 seconds. It does take a little time for the results to come in. We'll let it percolate in. So right now we're about at 60%. You're responding. I'll wait a couple more seconds to see if we can get to 70% response rate. Once we've got that, then I'll turn it off. Looks like we are there at 70%. I'm going to go ahead and close the poll and share the results. And what you see out there is that most folks out there tonight are international medical graduates, a lot from outside the United States, but we also have a fair number of students from inside the United States as well too. So welcome everybody. All right, so then my next question is, when do you plan to take the USMLE Step 1? So, is it really soon or later? Take your best, if you haven't decided, then you can either use July or whatnot. But go ahead and give us your best guess on when you plan to take the USMLE Step 1. Is it sooner or later or a lot later? And again, I'll leave it open for 10-15 seconds so we can at least collect 60% of the responses, and then I'll share it back with you. All right, we have about half of you responding, keeping it open for a few more seconds. Looks like 2/3 of you respond, so I think that's plenty. So let me go ahead and close the poll and share the results. And what you see is that it's kind of a big even spread, starting from December all the way through next this winter, all the way through next summer and beyond. But clearly it looks like, or clearly at least half of you will be taking it, after the USMLE Step 1 goes pass fail, and so we'll, or actually the bulk of you will be taking it after USMLE Step 1 goes pass fail. So we'll talk about certainly the ramifications of that. Okay, cool. So let's get back to the slides here. So again, with regards to the USMLE Step 1, it is a one-day exam. It is 8 hours total. There are 280 questions in 7 one-hour blocks, so that works out to 40 questions per block, or in 90 seconds per question within that 60-minute block. You do have a minimum 45 minutes of break time, but it can actually go significantly up, and I'll explain how in just a little bit. So you can see that there is an orientation block as well as the exam blocks that goes all the way through. So you can see the 7 blocks that are in blue, and somewhere in the middle you're going to get a lunch break, or you want to give yourself a bit of a snack break. You decide where that break is. It's not necessarily after the 3rd block. You can decide whenever that is or how you want to break it out. But the orientation block itself, you are allotted 15 minutes to do that. But it's the same orientation that block that you can get when you download the software from USMLE.org. So if you go ahead and do the orientation there, and before you get to the exam and end the exam, you just spend a minute or two just going into that orientation block just to adjust your headphones for the handful of multimedia questions, then you can actually save, and get 12-13 minutes, once you exit that block in a minute or two, that gets added to your block time. So most of you should be able to at least start off with close to an hour of break time. All right, so that's a little bit about the basics. On the USMLE exam, they have single best answer questions. A handful of them have multimedia, as I mentioned. Most of the questions are case-based questions or clinical answer or problem-solving questions. So that's going to be the vast majority of the questions. Over half of the questions will have multi-step reasoning. So what that means is that they will integrate multiple concepts together. So it may start off with something where it starts off with pathology, but then it moves to mechanism of disease or pathology and goes to treatment and then adverse events. So they can integrate concepts in a couple of different ways. And so here's an example of a multi-step question. So you may see a scenario where a 30-something-year-old woman presents with a 5-day history and occasional double vision and bilateral ptosis, so droopy eyelids. And and what they ask here is, what is the most appropriate diagnostic test? Now, when you first look at this, the first step you're going to think about is, what is the diagnosis, right? So you already know that this is more than one-step question, right? So what is the diagnosis? And then once you figure out what the diagnosis is, then you can think about what's the most appropriate diagnostic test to prove that that diagnosis, right? So that's an example of a 2-step question where they integrate a little bit of clinical presentation pathology with diagnostics. All right, in this particular case, this give this presentation, step one, what's the diagnosis? It's probably going to be something like myasthenia gravis. You can argue for something like multiple sclerosis, but it typically tends to have more unilateral findings as opposed to symmetric findings. But once you decide it is myasthenia gravis, the most appropriate diagnostic test these days in the United States will be an acetylcholinesterase, antibody assay. Classically and in the past, it would have been something like short-acting, edrophonium, which is a short-acting acetylcholinesterase inhibitor, or more famously known as the Tensilon test. That's no longer used in the United States. It still may be used some places internationally, but that gives you a good sense again of how a two-step question may present. And so you'll see a lot of that on the exam. This is what the interface looks like. And most of you are already familiar with this if you've been doing any work in QBanks such as USMLE-Rx. So you can see that you've got a stem, which is the case, and then the lead-in, which is the question. So in this particular case, it's asking about the most likely diagnosis, and at this point, you can tell that this is a one-step question, right? Because that would be that's the obvious question to ask. After a case is presented, you are given a minimum of 4, but mostly you're going to get five choices to choose from. Sometimes 6, sometimes 7, but mostly it's going to be 5. And about 10 to 20% of the time, you're going to get some sort of clinical imaging, whether it's histopathology like this. You might see some line diagrams. You might see some lab testings like a Southern blot or flow cytometry, and you may have to be able to interpret some data. You can see you got your navigation across the top and the side. You got the timer at the bottom. You can lock the exam. You say you need to go use the restroom or step out, but the timer will still be running when you and it only stops when you exit the block or you run out of time. Now, when you are within a block, you can go back and change your answers on any of these questions until you exit the block. If there is any time left in your block, when you exit the block, that rolls over into the time that you have remaining in the entire day. So that's how you can build even more break time, beyond the orientation block. All right, so that's worth keeping in mind. All right, so let's talk about scoring and passing. So for the next couple of months, what you need to know is, is that the passing is, the 3-digit score is 194, and the mean is going to be 229. It hovers around 230, occasionally bounces to 231, but it's really 229, 230. Standard deviation has been stable over the years, about 20 points, per, for a single, for standard deviation. If you're a U.S. medical student, you are going to essentially pass. If not on the first try, certainly within 3 tries. For international medical graduates, the eventual passing rate will be greater than 90%, but the passing rate on the first try, it's going to be a bit more challenging. It's going to be anywhere between high 70s, low 80s, depending on cohort to cohort. So that's the overall statistics right there. This is another way to take a look at the performance curves. What you can see here is that we've graphed out the scores by percentile, and you can see there's an S-shaped curve here where on the bottom end you can see the passing currently at 194, which is being reevaluated, by the way, and then at the high end it kind of tops out at around 270, 275 with regards to being the 99th percentile. So it's rare for people to get scores above 275, and then as you can see, there's the proverbial magical 250 that's at 1 standard deviation above the mean, and then the median of, as you can see around here, around 230. Okay, so in terms of defining your goals for those of you who are going to be taking the exam before January 26th, we try to keep it simple in first aid. There's passing the exam, there's beating the mean, which is scoring at the mean and up to one standard deviation above the mean, and then there's ace the exam, which is in our definition, our simplified definition is one standard deviation above. And even if you're just obviously trying to pass the exam, you want to be comfortably above that 194 threshold, 15 to 20 points if possible. You don't want to, you want to have good margin for error there, right? And for the longest time, this has been a relevant discussion because of the because these step 1 scores have been used for as kind of as a screening tool by very competitive residencies and very competitive specialties. You can see these are the major ones: radiology, radiation oncology, the surgical subspecialties, aesthetic, which is plastics, and dermatology. And so this gives you a sense of the ones that have been using it. For IMGs, that being said, almost all specialties are competitive, including the big primary care ones as well too. So generally if you're taking this before the January 26th, you're going to want to, the majority are going to want to consider doing at least beating above average, with regards to being competitive. So that being said, let's talk about pass-fail itself. So as you all well know, we are USMLE is on track to implement pass-fail around late January. They've made it clear that it could happen on or after. So there is a possibility that this can be delayed. So if you are thinking that you either if you want this to be truly pass-fail, you might want to make sure that it's well after the January 26th, because it may not be necessary January 27th. It could be a day. It could be sometime after that. That being said, the other thing to keep in mind is that if you are taking your step 1 before the January 26 pass-fail target date, your scores will be reported on all USMLE transcripts. That's just a given. But that question has come up, before. The other thing is for the osteopathic students that are on the call tonight, or on your complex exam will also go pass-fail a couple months later, in May. So that's where we're at, with all the pass-fail stuff. All right, so let's talk about some more data with regards to USMLE. I'll be brief here because this is going to be less and less important. You can see that, with regards to USMLE Step 1, there is a correlation between USMLE Step 1 scores, by matched US seniors and the specialty they go into. You can see that, in the more competitive specialties like radiology and orthopedics and dermatology and so forth, that the median scores, and this is a couple of years ago, are in the high, 240s. And for the big specialties, it's obviously more at the mean, like pediatrics and internal medicine and so forth, right? But that being said, a couple other thoughts I want to keep in mind. For U.S. medical students, this is by the way a graph that is no longer published. So this is very, very old data. I just want to focus on the shapes of the curve here, not the actual data points itself, just to make a point. For U.S. medical students, even if you scored low or Lord forbid failed, your probability of matching into specialty is still pretty high. This is now, back then the pass-fail threshold was like in the low 180s or something like that. But even back then, if you failed, as long as you were doing something like internal medicine, you could get into, you can successfully match. If you're a U.S. medical student, you're going for something very competitive. However, you can see that the chances drop off a little bit, as you approach the mean and so forth for some of those very competitive specialty. That's the light blue line here. For IMGs, the International Medical Graduates, there's a flatter curve, that you see here, over the years. So there is some correlation along with that, just to keep in mind for the purposes of planning. So I'm going to pause here, and for those of you that are taking the exam for SCORE, I want to hear what your goal is. Obviously, if you're taking USMLE after January, it's just going to probably be passing, right? But even at that, I'd like to know, if you were given a score, where you'd want to be. So let's go ahead and collect some responses. By the way, this is anonymous. I don't know who you are and how you're responding. This is all anonymized, but it's great to share with folks in the room, so get a sense of how people feel about how they need to perform on the exam. So I'll open it up for a couple more seconds, and then I'll share the results. All right, we're close to we have 2/3 of you that respond, so I think that's plenty good. I'm going to go ahead and close the poll and show the response here, and you can see, even though for the majority you will be taking the exam after January was pass fail, you still want to do really well. You still want to ace the exam, even if you're not given a score. Again, I don't know exactly when you're taking it, but a fair amount want to beat the average, and a good chunk want to pass comfortably. And that 14% is definitely higher, especially now that we're approaching pass fail, and that's going to be your only choice anyway. All right, great. Really appreciate you sharing that, that input. Let's get back to the slides here. So in first aid, we try to keep it simple with regards to different types of studies, because there's all kinds of variations and so forth. But we do try to break it down into if you're just passing versus you need to do better, or or you are somehow you have had previous challenges with standardized exams. So again, if you're just trying to pass or pass comfortably, we think first aid is a great organizational framework for your studying, and there are and you just need to supplement with some crammable subjects. We'll talk about what that is, and then you want to do at least 2 question banks, and we'll talk about the science behind question banks, and how that relates to performance later on. Again, if you need to perform higher, especially pre-pass fail, or you're one of those students that generally do not perform well on standardized exams, you may want to prepare more deeply. You will want to cover all the major subject areas, and you may be looking at you'll certainly be looking at 2, if not 3 question banks for preparation. All right, so now let's talk about study strategies. So the good news is that all of you have made it this far, so that means you have some expertise, with regards to preparing for high stakes exams like USMLE. It was like MCAT or other exams internationally. So you generally know you generally have some learning preferences that have gotten you through these exams. That being said, when you're studying, you might want to consider the structure and characteristics of the subject itself. So for example, microbiology and pharmacology, because of the way the information is structured, often lends itself well to tables and flashcards, and whereas subjects like physiology that are more conceptual in the relationship of the various concepts, tend to lend themselves to diagramming or mind mapping, in terms of understanding those relationships. You also need to understand the strengths and weaknesses of your curriculum, right? Depending on how well these subjects are taught and how organized they are, and quote unquote high yield they are for USMLE, you might want to supplement that or complement that with other resources. And then of course there's the time assigned to a particular subject or system, right? So if you're doing pathology, you're going to be spending a significant amount of time. Almost everybody will be spending a significant chunk of time with pathology, and so you'll be able to have more variety with your study strategies and your learning approaches, whereas with more restricted or limited subject areas, like let's say neuroanatomy or embryology or whatnot, you're going to keep things tight, and you're going to limit it more to question banks and some high yield reviews, for the most part, and maybe some flashcards and stuff like that. You're not going to necessarily go overboard because of the the time restrictions. So those are some of the considerations to keep in mind when choosing study strategies. Now what I'm going to do is I'm going to spend a little bit of time talking about what is generally high yield in the various subject areas or disciplines. You can also, even though a lot of places, I'm sorry, if you do study in a place where they teach by organ systems, which is obviously many schools, you can certainly extrapolate this to all the anatomy that's organ based, like GI anatomy and cardiovascular anatomy. So that goes for all disciplines. And as I go through this, I'm just going to cover the high levels. These notes are all available online, at my blog at first18.com. I'll show you where they are. But I'm just going to kind of hit on the highlights, and you'll see a couple of recurring themes. So one of the recurring themes that you can notice right away is that while they call the step 1 a basic science exam, almost all the cases that are involved, all the involve things that have some sort of clinical relevance. So if you're going to know anatomy, you want to preferentially learn anatomy that's tied to specific disease conditions, traumatic injuries. So what happens? What happens if you have a spiral fracture of the humerus in terms of the nerve that might run through the humeral groove, and where may that lead to motor or sensory deficits in the hand there. So that and then for procedures, common surgeries. I mentioned earlier that there are certain well-defined areas or boutique areas, if you will, like neuroanatomy, embryo. They tend to be high yield, and the nice thing is that they don't go beyond a certain level of complexity for the most part. The anatomy that you'll be required to identify, on the exam will not involve any gross anatomy. It's going to instead involve things like X-rays, CTs, and MRIs. So you need to be able to have a good basic grasp of radiologic anatomy. So that would be high yield for the exam. All right, so keep that in mind. Let's see. Moving on. Biochemistry is one of those crammable subject areas, and again, one of the what makes a subject area crammable is mostly when there's a regular pattern. There's a regular pattern to how the information is organized or how it's related to each other. So particularly for metabolic pathways, that's key, because there's always things about the pathway, including the substrates and the regulatory pathways and the enzymes and the cofactors and so forth. And hey, what happened if you have a defect with this enzyme or this reductase or this cofactor or whatever? And so that's what tends to be a recurring pattern with metabolic pathways, and they're again tend to be the ones that are testable tend to be tied to things that are demonstrable clinical deficiencies, disorders. Again, a lot of these are going to be genetic, rare stuff, but they do tend to get tested because they clearly illustrate pathophysiology, or what we call pathobiochemistry. On the lab technique side, it's more about things like how to interpret southern blots, western blots, and how to and other lab techniques like ELISAs and flow cytometry. All right, microbiology, immunology is also crammable, particularly the the micro/virology, parasitology, because again, what's going on there is that there's a regular set of relationships that they're testing. Remember that it's not just bacteriology, there's all kinds of other stuff, bugs that you need to deal with. And in terms of those regular relationships, they tend to think about lab diagnostics. They tend to think about, how these things, how they stain, what kind of gels can they be cultured on, where do they go, how do they get there, how is it diagnosed, what are the vectors, what are the reservoirs, and how they're treated. So those are pretty standard things that come up, particularly for the micro, the bugs, and the virology stuff, right? And then for immune response, it's not just the abstract, hey, what's happening with the complement cascade or B cell activation or whatnot, but what happens in normal health with vaccine manipulation, which is obviously super critical these days, and then with immunodeficiency diseases, right? When you get something knocked out, in your immune system, and how does that cause disease? All right, pathology is a really big topic. So obviously a bit of an understatement there. The key thing to know there is that for rare disorders, they tend to focus on hallmark characteristics, with regards to presentation. If it is a common condition like diabetes and this, that, either it's obvious, or they'll give you a uncommon variant, right? So for example, in pediatric asthma, it's very, patients, kids can certainly show up with just chronic cough, and not have any wheezing or shortness of breath. There may be some clues with regards to gender, age, ethnicity. We are seeing them, with regards to, trends with diversity, equity, inclusion. We're seeing less and less of this. But if you do see it, it should hopefully give some sort of indication of where it could fit. And remember, they're not trying to purposely trick you. But that being said, we often overinterpret. So if there's anything I would say, don't overinterpret the signs and symptoms. So if it's a white woman who's in her 40s, who's got like a central, who's got some, central lobular mass in the mediastinum and so forth, that could still be sarcoidosis even though she's not black, right? So don't let those things, fool you. Just because there may be some quote unquote classic presentations, that's not how it always works, right? With regards to buzzwords and trigger words and stuff like that, we certainly use those things in first aid, because they help with, memorization and learning and so forth. But on the USMLE, you need to know how those terms are actually spread out. So doing a lot of Q-bank questions like USMLE-Rx and UWorld and stuff like that will help you master those, those neutral descriptions that they use when they're trying to explain certain signs and symptoms. They're not using the double bubble sign. They're not using eponyms like Janeway lesions or Ross spots or anything like that. They're going to give you these neutral descriptions that you need to know how they present. On the path side, I'm sorry, on the imaging side, you will see gross specimens, photomicrographs, and along with the multimedia. I think the key thing to keep in mind is that you should obviously make your way through the case first, and then before looking at the photomicrographs and whatnot, because outside of context they can be distracting, and a lot of times, as you can see here, you can come to a preliminary answer without looking at the clinical imaging. All right, pharmacology is also generally high yield because they tend to focus on a couple recurring themes like mechanisms and toxicities. The major, in terms of low-hanging fruit, it's really the major variant, examples in the classes. minor derivatives or variants might be worthwhile if you're trying to score high on the exam, but that being said, you'll never need to know trade names or dosages unless you want to learn it for the purposes of, creating a better memory palace or learning framework. There are 6-7 major categories within pharmacology that we do cover in first aid, so make sure you cover that. And of course, because pharmacology is obviously related to therapeutics, it often ends up being clinically integrated with pathology, pathophysiology, as part of it. But remember, they're not going to be, they have gotten rid of most of the therapeutics, so they're not going to say, hey, what's the best treatment for this or whatever. Most of that's moved to step 2 CK. But what they're going to be saying is, they're going to be saying things like, somebody has a certain condition, or they're going to give you a case of a certain condition, and then they're going to say that the patient received appropriate treatment, but then they're going to be asking things tied to mechanisms and toxicity that's more related to the class of drugs as opposed to perhaps individual drugs. So I know that sounds a little complex. If you do Rx question, you'll know exactly why, because we've redone our pharmacotherapy questions to exactly mimic what USMLE is doing there in terms of not doing pharmacotherapeutics, but being able to test you on mechanism of action and toxicity, at the class level. All right, physiology, as I mentioned, is concept oriented, so that's where diagrams, mind maps work well. So it's really knowing about how things interact with each other, like the the HPA axis, hypothalamic pituitary adrenal axis, how hormones interact with each other, stimulate or inhibit each other. And again, almost always the physio will be within a clinical context. A lot of times integrated with pathology. It's often hard to separate the two these days. And I think that's that's a theme, in that they are trying to integrate a lot of these concepts, across the board. Psychiatry, this is a mixed area of various subjects: psychology, sociology, psychopharmacology. We tend to think about mood disorders, right? Depression and so forth, but but also think about some of these other areas like personality disorders, and these are all well covered in, or at least touched on in the psych chapter. Public health, traditionally has had biostats, epidemiology. There is some ethics. There is some healthcare delivery, safety, quality, though a lot of this is moving towards step 2 CK. Biostats and epi is still there on the exam, but what you're seeing a lot more these days, starting last year, are patient communications questions. So we have 100+ patient communications questions that often also integrate some ethical or patient difficult communications situations that you can look at, and prepare for on the exam. So that's a quick walkthrough of the of high yield areas. As I mentioned, I'll show you at firstaidteam.com the full where you can get a copy of this presentation. So again, you can review that in more detail later on. Now we're going to talk about review resources, right? You're almost going to be able to use. You're also always going to be using some sort of review resource. Most medical schools, are not, while there are obviously many great medical schools, most are not optimal in preparing you for this exam. And so, so there are, resources that you can use, such as question banks, text reviews like first aid, question banks like USMLE-Rx, case reviews, review courses, and all kinds of apps, online apps, mobile apps, for Q banks, flashcards, videos, and so forth. And so, in terms of picking and choosing resources, a couple of things you want to keep in mind. We do have a very comprehensive survey of review resources that we believe is very objective and non-biased. We publish it in First Aid every year. It's in section 4. we publish the high-level recommendations in the book, and then if you go to our blog at firstaidteam.com, you can download the in-depth review. Ratings and resources. That goes into more detail at absolutely no cost. So do check that out. Once you decide what you want to use, go ahead and grab those resources early and integrate them into your coursework if you're still in medical school, or whatever your review is. As soon as you can, just use them. But just use them early. The other corollary is buy only what you use. So that should be simple enough. As you start doing, you should be able to sense, what your limit is, what your pace is, and what's working for you. There really is no need to go out and buy extra stuff until you need it. Almost everything out there is available on demand. Just keep in mind that not all subjects are taught well by all resources. So be discriminating about what's good for path versus what's good for physiology or biochemistry or micro. It's rare that there's any one thing that does everything well. So just keep that in mind. So great. So now I'm going to ask another question. Just want to get a sense of what resources that you will likely be using in preparing for the step one. It could be none of the above, which is I doubt it, or all of the above, or something in between, maybe 2 or 3 of these things. Go ahead and give us some thoughts about what you're likely going to be using or are using to prepare. So again, it could be everything, could be just some of them, with regards to review. Here we'll give you a little extra time because it does take some folks extra time to do that. While you are answering a question did come in earlier. I didn't have a chance to answer, which was, will the score be raised once it goes past fail, and how will it affect IMGs? So what I'll say is that it's currently in review. I haven't seen they've announced it yet. They should be announcing it any time. So we may know before it goes past fail whether they're going to raise it. If they do, they're going to let us know. They're going to provide some time before that score takes effect. They do, so that's all we know at this point. So that's that. In terms of how that will affect IMG, obviously a score change will affect everybody, not just IMGs. Obviously, it makes it a little more difficult for everyone. So there's not much else to say that. I think there has been some questions about, hey, what happens if how will USMLE pass-fail impact IMGs relative to U.S. medical students and so forth? Nobody really knows. I mean, there's speculation that it may make things make it a little more challenging for IMGs because USMLE Step 1 was one way for IMGs to be able to show that they can score comparably with U.S. medical students, and so therefore get level the playing field. And also, if you're a U.S. medical student but going to an average or below average school, that also allows you to level the playing field as well too. But again, we really don't know until we won't know for a year or two how this is going to play out. But that's what people are thinking right now. I see that everybody has answered. I'm going to close the poll and share the results. And what you can see is that essentially everybody does question banks, and then the majority of folks great majority of folks are doing review books and videos, and then big chunks are doing flashcards and mobile apps. So that's that's all consistent with what we have seen. All right, so I'm gonna go back and talk about some study advice here. So a couple of things to keep in mind here is in terms of preparing for the exam, and I'm going to obviously ask Sean and Paras to speak up as well too, because as arts coaches, they discuss this type of advice all the time. But in general, you need to plan ahead with a study schedule, and you need to be able to have the discipline to stick with it. If you do certain things ahead of time, and this is where I'm going to kind of skip around a little bit, if you don't overschedule, in other words, you allow time for breaks and so forth, even you're getting dedicated, try to take off at least one day, a week, and not over cram your schedule, and also try to keep that long view in mind and use our checklist, you should be okay, in terms of preparing. I also would add that, in your overall schedule, you might want to build in a week or so, towards the test date where you have flexibility to go back and do additional self-testing or study in certain areas where you have some demonstrated weakness, where you might be able to pick up some low-hanging fruit points, with regards to that. Other advice tidbits that have been helpful to students in IMGs is remember to integrate and be able to apply. So again, the exam is not a test of your memory and recall. It's actually tends to be more of a test about your ability to integrate related concepts and how you can apply it to solve a problem, right? So it's not memorization, it's really application and a little bit of problem solving. I mentioned about the crammable subjects, and the key there is that if you have flexibility, in your schedule, you might, you might either do the study or the re-review of those crammable subjects like micro and metabolic pathways and pharmacology towards the very end. Otherwise, I would suggest that you coordinate those study sets, those disciplines and organ systems along with your school's curriculum if you're in the middle of med school before your dedicated study period. The other thing to keep in mind is that, while medical school is not there purely, for the purposes of preparing for the step one, most good medical schools should hopefully be able to teach you a lot of the high yield materials. And so focus on what's been taught in medical school that you already know to be high yield, that's validated by resources like first aid and others, and then make sure you take care of that before you go to other things that you haven't seen. So those are some of the general high level advice that we've been given. I'm going to ask Sean and Paras, if there's any other thoughts or ideas or things that they typically counsel with their students as an RX coach.
Yeah, thank you, Dr. Lee. Definitely a couple of things. First and foremost, we hear very often, my friend said, if I just do this, I'll pass the test, or my friend did this, or my friend said this, or I read this on Reddit, or I read this on a forum. Keep in mind that every student is different. You all learn differently, you have different strengths and weaknesses, you apply what you know differently. So what worked for your friend or what worked for somebody that posted something online may not necessarily work for you. So don't get boxed in by an idea that's given to you and planted in your head. Number two, we see very often students who come to us and they're, reluctant to take an assessment or an NBME because they're afraid of what it's going to show. Remember that an assessment is a tool that you can use to really guide your study process and make it more efficient. You can take that assessment, you can look at your strengths and weaknesses and develop a study plan accordingly. And for those of you who are interested, we do have a free study planner available at firstaidteam.com, and I put that in the group chat and sent that link out to all of you. So that's what I have to say, Dr. Lee.
Great, fantastic. Any other comments? All right, we'll go ahead and move on. Let's talk about computer-based testing. That's what CBT stands for here. So as a computerized exam, obviously you need to know the controls. If you want to know the keyboard shortcuts, there are some. The key thing with preparing for an exam like this is doing lots and lots of Q&A, throughout the process. I think that's something that you already know about. There's a lot of science behind this. I don't think I need to spend too much time, but studies have studies throughout the years, including one major study that was published about 8-10 years ago, that was published in the New York Times, showed that people who self-test themselves, that's what retrieval practice is all about, did better than people who just simply crammed stuff. You can see that here with repeated study. So even given the same amount of time, if all you did was just do questions versus just cramming, you're going to do better. And even if the questions are more complex inference, questions. With regards to self-testing resources, there's plenty, obviously, in addition to QBank. So there's obviously the USMLE sample test, the free 120, that's sample for format familiarity. A lot of folks will say that as kind of a low-key way to prepare in the final days, or you can use it early on to just get a sense of how the how the exam is structured. There's the NBME-CBSSA, that's comprehensive basic science self-assessment exam. There's about 6 or 7 versions of these. Like, I think they're 25 through 30, 31 or something like that. They're good. They're good for benchmarking. They're usually about 50 to 70 bucks. You can, when you get them, it gives you a couple hundred questions to do, and then when you're done, it's going to give you a histogram prediction of how it thinks that you're going to do on the USMLE Step 1. So, like I said, it's good for benchmarking. QBanks like USMLE-Rx, UWorld, and so forth, they're good for practicing and studying in simulation. For example, in USMLE-Rx, we have self-assessments that can help you simulate a half-day exam, or you can go into the main QBank and set aside questions for either a half-day exam or full-day exam to be able to simulate what it's like to on test day. Our question bank can predict your scores and your outcomes if you do enough of those questions. So it's also good for benchmarking and for prediction. All right. So as I mentioned earlier, there's actually a lot of learning science that backs up, the use of questions. So I'll explain or review some of the findings from these research studies over the last 10 years that have come out. One study looked at the effectiveness of QBanks versus flashcards. The bottom line is QBanks are more effective than flashcards. Flashcards are quick and easy, but QBanks tend to be more effective, pound for pound. That's not a shocker, right? Because QBanks, look much more like a real USMLE Step 1 question than typical flashcards. Now, that being said, how many questions do you need to do to improve your performance on the exam? On average, the studies have shown it to be anywhere between 300 to 450 questions to get 1 additional point on the Step 1, controlling for GPA and MCAT. Obviously, the lower the number, the more effective the QBank. We've done our own studies, and in our studies, you only have to do 280 questions, RX questions, to get 1 additional point on the Step 1. So if you were to do the entire, QBank, you should be able to get 10, 12 points, better, by doing that. Again, controlling for MCAT and GPA. So that's the hallmark of a good study, is that they can control for those confounders. In terms of the number of questions that you have to do, the bottom line is probably the more the better, but the studies have shown it to be at least 3,000 questions for best performance. And we're talking about 3,000 unique questions, not just repeating questions. That's what's down here, right? You often hear that, hey, do X question bank multiple times. The data doesn't actually support that. What it supports is that if you do the unique questions, that's what actually gives you the better score. The pitfall about repeating MCQs. Now, obviously, if you want to study a concept in an explanation because you just didn't know, that's perfect. That's great. But if you're going to repeat the MCQ, the pitfall there is an issue called fluency. What fluency means is that you can get the answer right just because you can see the pattern of the question. Patient comes in with a red plaid shirt, was the presentation, and then you say, aha, multiple myeloma. Right? Well, it turns out to be multiple myeloma. You see that again, and you might actually have a spurious relationship between red plaid shirt and multiple myeloma, because that's what the case was. So it has nothing to do with whether the patient had anemia had some fractures and over before you get the multiple myeloma. It was something that was kind of unrelated that helped you got that question. So that's called fluency, and that's a pitfall, you know, of what happens if you overly rely on repeating MCQs. Then the last thing is that a number of these studies have shown that first aid is actually effective. And one particular study showed that if you did 3 passes through first aid, it would improve your USMLE score, again, controlling for other things like GPA and MCAT. What we certainly would recommend is that if you do first aid, use it in an active way. So, for example, first aid flashbacks, which is part of USMLE-Rx 360, allows you to do 15,000 flashcards that remediate to first aid. So every time you look at the answer, we'll pull up the first aid fact that you can review, and so that's an active way of reviewing first aid, as opposed to just passively reading first aid and highlighting, and you're going to get much better results, through active learning versus passive reading. So that's the learning science there. Hopefully that's helpful. If there's any questions, just let me know. Just drop that in the Q&A, and we'll be happy to talk about it. Let's talk about test day itself. On that day, you're going to be obviously very jazzed up. So think about how you deal with your stimulants like coffee. You're going to be going in. Most of you will be going into an office building. The Prometric Center are almost always in these standard nondescript office buildings that tend to run cold for whatever reason. I don't care what time of the year it is. I don't understand why. So come in with layered clothing so you can adjust, for comfort, regardless of whether it's hot or cold in the building. When you talk to our RX coaches, we have a very specific methodology, a 7-step process for breaking down, dissecting a question. In fact, we have a whole talk about that. That being said, even whatever method you decide to do, there are sometimes questions that have long cases or stems at the very beginning. So even if you favor another type of methodology, just make sure you look at what the question is. Is this asking about diagnosis? Is this asking about mechanism? Is this asking about side effects or whatever before you go to the case? So that gives you some orientation about what problem you're trying to solve, right, in terms of breaking down the steps and this, that, and the other. Again, we have a 7-step process that will automatically take you through this process. But even if you choose a different process, this is a way of dealing with it. In terms of managing the clock, as I mentioned earlier, it's 90 seconds per question. So 40 questions in a 60-minute block. We recommend that when you're trying to break down this question, regardless of how difficult or how easy that question is, come to a decision within 75 seconds, or 60 to 75 seconds, and move on. So either the answer, you got it, or you got it down to 2 or 3, and then so you take your best guess and then mark it if you think it's solvable. You want to come back and look at it, or if you have no idea what's going on, just mark it. But whatever it is, move on, because if you do that, if you commit to getting to at least a preliminary answer or moving on, when you get to the end of the 40 questions, you'll still have 10 to 12 minutes left that you can use to go back and solve, work on the solvable questions. Learning science has shown that you can second guess yourself if you do it intelligently and deliberately. Sometimes reflecting on the question for a little bit longer, the solvable ones will give you an extra couple of points. So that's the benefit of moving fast and then saving some of the solvable questions for the end. We talked about breaks earlier. You can take a break anytime between blocks, and you can a lot of folks, and it's just up to you on how you want to do it. Some folks take a break after every 2 blocks with some snacks or whatever. Others will go 3 blocks, take a light lunch, and then 2 and 2, and then a snack or so forth. It's up to you. And again, if you want, you can go into USMLE-Rx, create a full day simulation, 7 blocks, and use that as the way to gauge your energy level throughout the day, so you can decide when you want to take a lunch or a break, so that you can optimally maintain a high energy level throughout the day. The last thing I'll talk about is what we call the C reflex. It was a joke that I had with my classmates in med school, which is if you don't know what the answer is at all, you have no clue what's going on, pick a letter, C or B, and just move on. As I mentioned, you do not want to agonize over a question. You need to make a confident decision. I either know it, or I don't know it, or I think this is solvable. You got to put it in those 3 buckets, and then solve for those 3 buckets. There's essentially a protocol. If once you've kind of decided what bucket of solvability it belongs in. Remember that there are a fair number of questions on the USMLE that are either experimental or are there for psychometric purposes. So if it just looks ridiculous and you don't know, you've never seen anything like that before or whatever, just take your best guess, move on, capture that as much of that 90 seconds, and you can use it to solve something else. It's a victory if you also know that this is not solvable, so you can move on and you can capture that time. Almost as much as knowing the correct answer.